Okay, let's talk about how you're gonna take care of puffy eyes. And I think the first thing you have to understand is that it's a really hard thing to treat. So it's much easier to prevent it from happening than it is to treat it. But what I'm gonna go through today is all the different things you can do to treat it, although none of them are perfect, and then end with the things that really will prevent it in the first place, which is probably where you should try to focus your time, particularly in the holidays. So if you're anything like me, you have a lot of devices at home. So there are mechanical devices like massaging ones, like this is Joanna's check. And what that does, if you have mechanical massage on your face, it will activate your lymphatics and make things drain more quickly. That doesn't mean fast. It doesn't mean in like an hour. But what you want to do is you want to make sure that you have good lymphatic drainage going down to here. Because what it comes down to is right here in your clavicle, that's where your lymphatic drains to. So when you use a massage instrument, you don't want to push hard. You want to pull out to your lateral face and down, and you work from your jawline up to your eyes and go around your eyes as well as above your forehead. So that's the concept. Joanna Check wants you to do this 4 times and repeat it with a series of 3 to go up and then back down into your drainage basin. And that's gonna help get the puffiness out from underneath your eye. If you don't have this particular one, there's a lot of other ones out there. This is the PMD face cleaner. I don't think you should use this to start cleaning your face. I'm worried about that. But you can use the massage side, same thing, just to improve lymphatic drainage by pushing it in the same direction, out and down. In addition to this one, there is the good old, sorry, I'm trying to get this to turn off. The TheraFace, love it. Feels really, really good. And it has multiple different attachments. You can use this in the same way where you turn it on. You don't want a lot of massage. You want it on the lowest setting, and you don't want to push heavy because lymphatics are really superficial. And if you massage too deeply, it's actually going to help prevent the drainage instead of making it go away. So same concept, sort of outward, down, and you have to do it a series of multiple times. It's not a one and done. Now, if you only have time to do it once or twice, it still will help, but just not as much. The other technology that can be beneficial is electrocurrent or microcurrent. And this is the new face device. This is the zip device. Actually, the TheraFace has an attachment. So you don't have to have a singular device, but any one of these will be beneficial. And what the microcurrent does is same thing, it actually activates the muscle to contract, and contracting the muscle is going to help get fluid out of your face. So one is massaging it out manually, the other one is massaging it out by activating the muscle so it will leave. The other thing you can do is go for a run. Getting your face all inflamed and pink and red from exercising increases the blood flow to your face and makes it so that fluid's gonna get out of your face faster. In regards to eye patches, like they're lovely and you can put them on and they're cooling. They're going to cause vasoconstriction, which will help a little bit with puffiness, not a lot. Where eye patches are helpful is that they actually help puff up the top layer of your skin, your epidermis, so you look less wrinkly. So if you're wrinkly underneath your eyes, that's where hyaluronic acid can be helpful. That's where the eye patches can be helpful. But if you actually have deep puffiness, eye patches aren't going to be as helpful as the other technology I've already talked about. Now, big picture, what should you do to just not get puffy in the first place? Everyone's anatomy is a little bit different, but the vast majority of people who get filler placed sort of midline, so from your pupillary line, midline in this area, that's going to increase your risk of having swelling underneath your eyes if you have alcohol or salt or sort of high glycemic index foods. That this is just a really important area for there not to be pressure so that there can be drainage. Your lateral cheek and lateral lower orbit, those are safer places to have filler, but I really rarely, if ever, will put filler in this location on people. If they have dark circles, if they have crepiness, that's where PRP is going to be much better option because you don't have the risks of swelling, and PRP does a beautiful job for crepey skin, and all of us have crepey skin here. That's just kind of the way it is. Okay, salt. Salt is not your friend. By the time you're about 35, salt is really not your friend for your face. So if you know you need to look good, if you know you have an event the next day, really be careful about your salt intake at least 24 hours before. That same goes for alcohol, and that same goes for high glycemic index foods. You really want to focus on proteins, on vegetables, and things that are just easier for your body to process and are not going to lead you to get puffy and doughy when you want to look good. But that's really it. There isn't a magic cure. Like, you can put tea bags on your eyes, you can use all this different technology, but really what it comes down to is your body has to process the fluid and get it out, and that just takes time. So I'm sorry for that. There's no instant fix, but at least now you know what you're up against. Let me know if you have questions. Please subscribe if you find this helpful, and I look forward to answering more questions as we go along. Thank you.